not always a requirement. In fact, the only two substances that require a detox is alcohol and benzodiazepines, but we can't make people do that. So if our client won't go to detox, we still have to figure out maybe how we can intervene. But the reason why it is required for alcohol and benzodiazepines is because the detox is fatal, has the potential to be fatal. It can kill you. And so that's why it's required for those two, if possible. But if not, then as clinicians, we have to talk to people about safe titration, right? Going from drinking a pint or a half liter a day to cold turkey is very dangerous, but also we'd be looking for something like delirium tremens, right? Or the shakes. This would tell us the body is now reliant on alcohol to function, which means the risk of that fatal withdrawal is even higher. So that's why we have a lot of checkpoints where we're looking for it, but detox is not a process for a lot of people. It's not a requirement to be able to start into it, and it's not treatment. It's kind of, again, people when they're using, they're not completely connected. And so the idea is that we need to get the substances out so that people can start to engage and connect, particularly in relationships, right? Substances are turning off how we feel. How we feel is how we create connections. We know that 60% of the effect in therapy is the relationship between us, not the right words, not the perfect curriculum. And so if they can't develop a relationship, then it's already going to be hindered in a number of different ways. And a lot of our clients are used to, in every area that they come into, being judged. They go into ERs and people will say, get them out of these beds. We need it for real patients, right? They come in and they ask us if we're in recovery, which really, it doesn't matter. You do not have to be in recovery to work with this population. But what they're really asking you is, will you judge me? And your answer to that question will change your relationship with them. If you use a trained response, help me understand what you're asking me about me, treatment should really be about you, right? You're going to start 10 feet in a hole, because this is a population that they've been told they don't matter. We won't give them Hep C treatment, right, until they're really, really sick, because why would we treat you at $85,000 for treatment when you're still using, right? And there are very few places that will treat when people are still using for the complexities of that virus. And so it becomes this really complex narrative about what it is. But statistically, that 10% who struggle, 50% quit on their own. They never go to treatment. And what is so scary about our field, and Michael knows over time, right? Because rehabs have no requirements of what they have to provide, we have no data that shows that they are effective. So when we look at this population saying, you should keep going to rehab, which is often $36,000 a pop, when you have a client who has been to rehab 17 times at $36,000 a pop, who is benefiting? Not the client, right? Not the client. This is a very interesting place where this is a very profitable industry. And now that we have all the opioid funds coming in, everybody wants to get into this mix now that there's money behind it, right? But it's a really scary thing now, and how we're going to start standing for a vulnerable population and standing up for them to hold the standards, to realize these aren't money-making deals. And this is what hit Florida really hard. It's why they wanted to regulate sobriety homes in Colorado. Private insurance will pay $1,500 for a UA, just for a UA. So I have a small facility of, let's say, so once a week, I have a person do 3 UAs a week. So that's $4,500 in a week just from UAs, right? And then if I have a small facility of 10, that's $45,000 a week just on UAs. That's $4.5 million by the end of the year. That's why UAs are now being called liquid gold, right? And why people are moving away from the accountability idea, because UAs don't catch very much. And if they don't catch much, it's an artificial illusion that people are clean, both to the clinician and to the client. And frankly, if you're still using and living your best life, I don't care. I don't care. The only reason I care is when it's causing distress in your life and you're telling me it's not working for you. That is the only times we can care. I work with a Fortune 500 executive. He plays with methamphetamine every 6 months. We never talk about meth, ever. Because by every measurable objective, it is not affecting his life. Whether or not I agree with it is irrelevant. Every person has the autonomy to choose. They get to choose whether or not you agree with their choices, right? That's the freedom to do so. And so we have to manage that decision. I'm doing some funky moves on Kathy's screen, like getting my good dance moves, right? But we have to do these things to realize, right? Like, yes, it's painful to watch someone slowly die. But a majority of our clients, it's not their intention. They're not doing this to hurt others. They just don't know how to hold and manage what's happening inside them. And so the secondary consequence, right, is the people who love them are watching them slowly die. And that's something that has to be managed differently and not used as a tool to manipulate them. Because a substance abuse client needs shame the same way that someone dying of thirst needs salt water. It will kill them. You're pushing them into the very thing that often drives them into these behaviors. So I challenge you all to learn your clients, pay attention to your stereotypes, right? And that's why we have to learn and take these classes, is because all of us have been innocently socialized to believe right, wrong, good or bad, based on the federal schedule, based on histories. And some of those things weren't laid out really based on risk. They were laid out based on the perception and the value of the user. So that's the dark history to this field that we have to acknowledge when we look at the social application.